there's a number of blood tests that patients with myeloma can have, and your doctor will prescribe different blood tests at different times. But the most important blood test is what's called a paraprotein estimation, or an assessment of the monoclonal band or the M band. And what that is that's a protein that's produced from the myeloma cells. So what normally happens in plasma cells is that they normally produce a protein that looks like a fork. It's called an immune globulin. And that immune globulin in normal people is produced by white blood cells, these plasma cells. And what happens is that these typically attack and bind onto bacteria or proteins that might be invading the body. Now what happens in myeloma is that goes wrong, and way too many of these proteins are produced, and these fork-like proteins can be measured, and they're called the M band. And so those levels can be quite high. They can be 10, 20, 30, 40, and it varies from patient to patient. And so what's commonly measured is this M band, and that hopefully will decrease over time as the patient responds to treatment and maybe approaches to zero. So one of the key tests is this protein in the blood, and similarly we can see these blood tests, these blood proteins which can leak through the kidneys and be seen in the urine. And that's an assessment of the urine protein, sometimes called the Bence-Jones protein.